Let's explore the world of gallbladder pain and its symptoms together. This guide is based on expert insights from Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE. We'll help you understand those confusing signals your body sends when experiencing gallbladder issues, making it easier to recognize when you need medical attention. When that nagging or sharp pain hits your abdomen, your gallbladder might be trying to tell you something important. The key to understanding what's happening lies in the specific details. Where exactly does it hurt? What kind of sensation are you experiencing? And what other symptoms come along with it? Let's decode these signals together. Let's take a closer look at this fascinating organ, your gallbladder. Tucked away beneath your liver in the upper right abdomen, this small, pear-shaped powerhouse stores and concentrates bile, a digestive fluid produced by your liver. Think of it as your body's natural fat processor. When you eat fatty foods, it releases bile into your small intestine to help break down those fats. What's actually causing that gallbladder pain? Usually, it comes down to something disrupting normal function, typically through blockage or inflammation. Gallstones, those troublesome hardened deposits that can block bile ducts, often trigger sudden, intense pain called biliary colic. When these stones cause obstruction, it can lead to cholecystitis, a severe inflammation requiring medical care. Less frequently, conditions like biliary dyskinesia, infections, or rarely tumors might be the culprit. Where exactly does gallbladder pain show up? Most commonly, you'll feel it in the upper right part of your abdomen, just below your rib cage. The pain can take 3 distinct forms. It might feel like a sharp, sudden stab, come in waves like cramping, or persist as a dull ache that just won't go away. Here's something interesting about gallbladder pain. It loves to travel. Thanks to shared nerve pathways, you might feel discomfort in surprising places, what doctors call referred pain. Many people experience a deep, dull ache in their right shoulder, while others notice pain between their shoulder blades. Sometimes the discomfort even spreads to the chest, creating a tightness that people occasionally mistake for heart problems. Your body often sends multiple signals when something's wrong with your gallbladder. On the digestive front, you might experience nausea, vomiting, bloating, and notice changes in your stool color. When inflammation sets in, you could develop fever and chills, feel unusually tired, lose your appetite, or even develop jaundice. That telltale yellowing of skin and eyes that suggests your liver's involved. Let's talk about how to tell gallbladder problems apart from other upper abdominal issues. Doctors focus on 3 key aspects: where it hurts, what kind of pain you're feeling, and what triggers it. Gallbladder issues typically cause sharp or cramping pain in the upper right abdomen that gets worse after fatty meals. Compare this to stomach ulcers or acid reflux, which cause burning pain in the upper middle abdomen and respond to antacids. Pancreatitis has its own signature: intense, constant pain in the central upper abdomen that often shoots straight through to your back. When you're dealing with abdominal discomfort, asking yourself the right questions can help paint a clearer picture. While nothing replaces a proper medical evaluation, noting specific details about your symptoms helps tremendously. Think about when the pain occurs relative to meals, any other symptoms you're experiencing, and what seems to make you feel better. These insights will be invaluable during your medical consultation. Let's talk about those crucial warning signs that mean you need immediate medical care. While monitoring your symptoms is good, never ignore these 5 red flags: severe pain that won't let up, high fever above 100.4 degrees Fahrenheit with chills, yellowing of your skin or eyes, continuous vomiting, and significant bloating of your abdomen. If you experience any of these, head straight to emergency care. Getting to the bottom of your symptoms requires the right diagnostic tools. Your doctor will likely start with an abdominal ultrasound, a painless test using sound waves to look for gallstones and inflammation. If that doesn't tell the whole story, they might recommend a HIDA scan to check how well your gallbladder functions. For more complex cases or when complications like pancreatitis are possible, CT scans or MRI studies might be needed for a detailed look inside. For milder gallbladder issues, several non-surgical approaches can help manage symptoms. The strategy combines three key elements: switching to a low-fat diet to prevent attacks, staying well hydrated and maintaining a healthy weight to reduce gallstone risks, and using pain relievers like acetaminophen or ibuprofen when needed for discomfort. When gallbladder problems become severe, laparoscopic cholecystectomy stands as today's gold standard treatment. This modern surgical approach offers remarkable advantages over traditional open surgery. Tiny incisions that mean less scarring and pain, faster recovery letting you return to normal life within weeks, and lower risks of post-operative complications like infections. It's truly transformed how we approach gallbladder surgery, making it safer and more efficient for patients. You've gained valuable insights through this guide. From those initial moments of uncertainty about unexplained pain, you now understand gallbladder symptoms, can distinguish them from other abdominal problems, and know when immediate medical attention is necessary. This knowledge helps you have more productive conversations with your healthcare provider. Understanding your symptoms marks the beginning of your path to feeling better. While this guide provides valuable information, it can't replace professional medical guidance. If you're experiencing symptoms that suggest gallbladder problems, please consult a healthcare professional for proper diagnosis and personalized treatment. Early action often prevents complications and leads to better health outcomes. A final important note about our medical disclaimer. Everything we've discussed is for educational purposes only and isn't meant to replace professional medical advice. Always consult your physician about health concerns, and don't hesitate to seek emergency care when needed. This information doesn't create a doctor-patient relationship. Your healthcare provider remains your best resource for medical guidance. Thank you for watching this video.